So next topic that we will be dealing now with is pancreatitis. So what is this pancreatitis? It is nothing but inflammation of the pancreas. So what is this pancreatitis? It is nothing but inflammation of the pancreas. So pancreatitis can be classified into two, that is acute pancreatitis and chronic pancreatitis. Acute pancreatitis, it usually occurs suddenly and lasts for few days. Okay, acute pancreatitis occurs suddenly and it will last for few days. And next is usually chronic pancreatitis. So chronic pancreatitis occurs for many years. Okay, it usually occurs for many years. So what is that? So normally it is seen that pancreatitis, it is inflammation of the pancreas, and it is usually classified into two, acute pancreatitis and chronic pancreatitis. Acute pancreatitis, where it will be occur suddenly, it will be last for few days, whereas chronic pancreatitis will be present for many years. And this is what is the function of this pancreas? Pancreas releases hormone insulin and glucagon. Okay, it releases hormone insulin and glucagon. So as it helps in the digestion and absorption of food. Okay, it helps in the digestion and absorption of food. So what is pancreatitis? It is inflammation of the pancreas. And what is the function of pancreas? Pancreas usually releases insulin and glucagon and it helps in digestion and absorption of the food. So this pancreatitis is classified into acute pancreatitis and chronic pancreatitis. So what is acute pancreatitis? Acute pancreatitis, it is usually occurs suddenly and will be present for few days, and chronic pancreatitis, it will be present for many years. So now we will see detailing what is this acute pancreatitis, what is the management of acute pancreatitis, and what is chronic pancreatitis, and what are the management of chronic pancreatitis. So first is acute pancreatitis. So acute pancreatitis, it usually occurs inflammation of the pancreas only, which will occur suddenly and it will be resolved within few days after treatment. So acute pancreatitis can become life threatening if they develop complications. So acute pancreatitis, it is usually inflammation of the pancreas which usually occurs suddenly and it will be present for few days, and after that it resolves for few days when treatment, and it becomes severe only when it develops, like it becomes life threatening only when they develop severe complications. So next is causes and risk factors. What are the causes? It might be due to gallstone, cholangitis. Cholangitis, it is nothing but inflammation of the bile duct. So it occurs due to cholelithiasis, cholangitis, excess alcohol use, okay, excessive alcohol use of medications such as corticosteroids, okay, use of medications such as corticosteroids, or it can be due to infections such as viral infections, it can be due to any infections such as viral infections, or it can be due to trauma or any metabolic disorders, or in case of surgery, that is pancreatic surgery. So the causes, it can be due to like cholelithiasis, cholangitis, use of medications such as corticosteroids, any surgery that is pancreatic surgery. Then in case of metabolic disorders, or in case of trauma, or in case of any infections such as viral infections, these are usually causes of acute pancreatitis. Okay, it can be due to causes of usually causes of acute pancreatitis. So next is it is usually pathophysiology of this acute pancreatitis. Pathophysiology mainly it includes that trypsin. Okay, the pathophysiology mainly it includes that the trypsin releases cascade of enzyme activation. Okay, it usually activates enzyme. Due to this, what happens? Pancreatic damage occurs or autodigestion will be there. Due to this, there is systemic inflammatory response syndrome. Okay, they develop systemic inflammatory response syndrome that usually leads to fluid loss and vascular alterations. Okay, that usually leads to fluid loss and vascular alteration. That usually leads to organ failure. Okay, that usually leads to organ failure and multiple organ dysfunction syndrome. Okay, that usually leads to organ failure or multiple organ dysfunction syndrome. So that is usually seen is that they might be trypsin that usually activates this cascade of enzyme. Then due to this, the pancreatic damages or autodigestion occurs, and there is systemic inflammatory response syndrome develops that usually leads to fluid loss and vascular alterations, or there will be organ failure and multiple organ dysfunction syndrome. So this is usually the pathophysiology of this acute pancreatitis. So next is symptoms of this acute pancreatitis. The symptoms, it can easily that there will be abdominal pain. The abdominal pain will be in the upper left side or middle abdominal. Okay, so that is they will be having upper left side or middle. So the abdominal pain will be there. That will be radiating to back or left shoulders. Okay, or they will be radiating to back or left shoulder. So that is they will be having they will be having abdominal pain. Excuse me. That radiates to the back or left shoulder. Okay, that is usually radiates to back or left shoulder. Then they will be having swollen abdomen, nausea and vomiting will be there, fever, increased heart rate, Then they will be having hypotension, okay, they develop hypotension, dehydration will be there, clay colored stools will be there, hiccups will be there continuously, okay, hiccups will be there continuously, and they will be having jaundice, lesion will be developed, or respiratory distress. So these are the symptoms of this acute pancreatitis. So what are the symptoms of acute pancreatitis? So they will be having upper left side or middle abdominal pain that will radiate to back or below the left shoulder. Abdomen will get swollen, nausea and vomiting will be there, and then a respiratory distress can be seen, okay, respiratory distress will be there, jaundice will be there, hiccups will be present, clay colored stools will be there, indigestion will be there, hypotension can occur, dehydration will be there. So this is usually about the symptoms that is usually present in this acute pancreatitis. So next is diagnosis. So diagnosis, mainly we go with medical history and physical examination. Then we go with pancreatic enzyme test, okay, then we go with pancreatic enzyme test. Complete blood count will be done, abdominal scan, CT scan and MRI scan will be done, and then MRCP, that is magnetic resonance cholangiopancreatography will be done. So what are the diagnostic tests that we have to do? So diagnostic tests that we can do, it is that medical history can be collected from the patient. Physical examination will be done where we can see like tenderness in the abdomen or abdominal pain can be felt. So that is usually there. And next we can go with MRI scan, CT scan, abdominal ultrasound, pancreatic enzyme test. Then we can go with magnetic resonance cholangiopancreatography. So this is about this diagnostic test that we have to do. So next is management. So what is the management that we do? Mainly in case of treatment of this acute pancreatitis, as you all know that it will be treated within few days when proper treatment is given. So therefore, we start with IV fluids. Okay, we start with IV fluids. Antibiotics will be given. Okay, we start with IV fluids. Antibiotics will be given. Analgesic medications will be given to relieve pain. So that is usually done. Other than that, we give them like insulin will be given correctly. So to reduce this hyperglycemia, okay, the insulin will be given. So that is usually about this management that we have to do. So normally with proper treatment will be reduced for a few days. So therefore we start with IV fluids, insulin can be given, antibiotics can be given, analgesics can be given. Along with that, if my vomiting is there, okay, along with that if vomiting is there, then we have to place a tube from the nose to the stomach and remove the fluid and air, okay, but remove the fluid and air. So that is NG tube can be placed and we have to remove the air and fluid. So that is usually about this management of acute pancreatitis. So acute pancreatitis, it is inflammation of the pancreatitis which will be present for it occurs suddenly and will be it will go after treatment. It will be remaining for few days, then after treatment it will be cured. So next is chronic pancreatitis. So what is chronic pancreatitis? Chronic pancreatitis is also inflammation of the pancreatitis which will be present for a longer duration. It will be present for a longer duration. So that is usually about this chronic pancreatitis. So chronic pancreatitis occurs it will be present for a longer duration. This is also inflammation of the pancreas. So the causes the same of that acute pancreatitis: heavy alcoholic use, and then in case of hyperglycemia, cystic fibrosis, and then hyperthyroidism, hyperparathyroidism, certain autoimmune conditions or use of certain medication. So causes, it can be like use of certain medications, autoimmune diseases, hyperparathyroidism, hyperglycemia, cystic fibrosis, and then in case of heavy alcoholic use. So these are usually the causes of this chronic pancreatitis. What are the symptoms? So what might be the symptoms of this pancreatitis? Same thing: abdominal pain, weight loss, nausea, vomiting, cramps will be there, diarrhea will be there, and few cases you can see constipation also. Diabetes increases, okay, diabetes increases, jaundice will be there, malabsorption will be there, and then there will be stools will be very smelly, okay, the stools will be very smelly and greasy, and then clay colored stools. So these are usually the symptoms which is associated with this chronic pancreatitis, that is weakness, weight loss, abdominal pain, abdominal cramps, jaundice, diabetes, malabsorption, and then poor malabsorption, smelly and greasy stools, and clay colored stools. Okay, this is usually the symptoms that is associated with chronic pancreatitis. And next is diagnostic evaluation. So diagnostic evaluation, same thing: medical history and physical examination. X-ray will be done of the abdomen, abdominal ultrasound, CT scan and MRI scan of the abdomen, and then ERCP will be done. ERCP also will be done. Endoscopic retrograde cholangiopancreatography will be done, and then blood test, urine test, stool test will be done. So that is usually that history collection, physical examination, X-ray of the abdomen, abdominal ultrasound, CT scan and MRI scan of the abdomen. So diagnostic test that we have to do is that X-ray of the abdomen, ultrasound of the abdomen, CT scan and MRI scan of the abdomen, and then ERCP and blood test, urine test and stool test is done in order to confirm with chronic pancreatitis. So next is management. So in management, it is mainly developed to prevent the complications or to prevent the symptoms to get severe. So what are the things that we have to do is that, first is that we have to give adequate nutrition. Okay, first we have to give adequate nutrition. So it is, we have to, so it is fluids should be given regularly. Okay, fluids should be given, that is IV fluids should be started. If vomiting occurs, then same thing how we have told in the acute pancreatitis, that a tube will be inserted from the nose to the mouth and the fluid and the air will be removed. So that is acute nutrition should be maintained. Then enzyme replacement medication should be given. So that is mainly we go with giving them insulin. Okay, we go with giving them insulin. So that is usually given, regular insulin should be given to the person. And next we have to go with giving them analgesics, that is to control pain. Okay, that is mild paracetamol will be given. Okay, we have to give them we have to give them mild paracetamol so that they can control the pain. Then lifestyle changes, that is we have to stop drinking alcohol. Their dietary changes have to be done. Okay, dietary changes have to be done. So like fat food should be avoided. Then small meals. Okay, small meals they can have. So it is usually about this management that we go. So management mainly we go is that mainly to treat like we have to prevent the complications to develop. Okay, we have to prevent the complications to develop. So that is one of the things that we have to do is that we have to go with giving them good nutritious diet. Then we have to give them enzyme replacement, that is insulin should be given. Then we have to go with controlling the pain, that is mild paracetamol should be given to them. Then lifestyle changes have to be done. So this is the management that we have to do, or this is the treatment that we start in order to control this chronic pancreatitis. That is good nutritious, adequate nutrition should be provided. Like they can give, like fluids should be started. And then we have to, if vomiting is there, I have told you the acute pancreatitis that a tube will be inserted from the nose to the mouth. Then we have stomach, then we have to remove the gas, air and the fluids that is usually present. So that is usually done. And then we can start with NG tube feedings. Okay, we can start with NG tube feedings. Then in case of this, enzyme replacement medications like insulin should be given. Then we have to start with control of the pain, that and mild paracetamol can be given. Then lifestyle changes should be done. So that is usually about this management, that in order to control the symptoms and in order to control the complications. Other than that, surgical management is also there. So surgical management mainly includes is that it mainly includes like the blocked ducts will be removed, or it might be like partial or entire removal of the pancreas. Okay, partial or entire removal of the pancreas. So it is mainly in case pancreatectomy. Okay, they go with pancreatectomy where partial pancreas will be removed. Like removed a small part of the pancreas will be removed. That is the body and tail will be removed, and in that partial and total complete pancreas will be removed. Okay, complete pancreas will be removed. So in case of this pancreatectomy, it can be done like partial pancreatectomy and total pancreatectomy. In case of this partial pancreatectomy, a small portion of the pancreas will be removed, that is body and tail. Whereas in total pancreatectomy, the complete pancreas will be removed. Okay, the complete pancreas will be removed. So that is usually done. Next, in case of endoscopic surgery, okay, they go with endoscopic surgery. A narrow, hollow, flexible tube will be inserted into the digestive tube, that is endoscope. You would have seen that endoscope. So that tube will be inserted into digestive system, that is being seen through ultrasound. And then a tiny device like tiny inflated balloon will be placed at the end of the endoscope. Okay, will be placed at the end of the endoscope, and when it reaches the end, like pancreas, the balloon is inflated. Okay, when it reaches the balloon is inflated, so that the duct which has been blocked, it will be opened. Okay, the blocked duct which is blocked, it will get widened. Okay, it gets widened, and then a stent will be placed in that gap. Okay, stent will be placed in that gap, so that it will not narrow again. So in the surgery, it is mainly done like we go with removal of the pancreas, or we go with clearing the blocked ducts. So in that in order to remove the pancreas, we go with pancreatectomy. In order to go with surgery, like in order to go with this in order to correct the ducts, remove the narrowing, then we go with endoscopic surgery. So endoscope will be inserted in the digestive system, where at the end of the endoscope tube there will be we will be placing a balloon. So once it reaches the duct, the balloon will be inflated and a stent will be placed so that it will not narrow back again. So that is usually about this endoscopic surgery. So in this, next is pancreas resection. Pancreas resection, the head of the pancreas is surgically removed. Okay, the head of the pancreas is surgically removed, and then it is usually it is removed because it reduces the pressure in the duct. Okay, it reduces the pressure in the duct. So in this pancreas resection, a head of the pancreas is removed so that it will not so pressure in the duct will be removed. So this is about this management of pancreas, that is chronic pancreatitis. So this mainly we go with nutrition management, enzyme replacement, diet, lifestyle changes, and then mild painkillers will be given. And then we go with surgery, endoscopic surgery, pancreatectomy, and then pancreas resection. So chronic pancreatitis is nothing but inflammation of the pancreas which will be present for a longer duration. So that is usually about this pancreatitis. So pancreatitis is inflammation of the pancreas, will divide into acute and chronic. Acute pancreatitis is also inflammation of the pancreas which occurs suddenly and will relieve for a few days. It will be present for a few days and it will be cured with proper treatment. Chronic pancreatitis will be present for a longer duration.